So why do we do the B2s and the B3s separately? As I said, they have very often opposite effects. Some of them stimulate the sympathetics, some of the parasympathetics. But most importantly, you've got to remember really is B1 is a vasoconstrictor. And this is important for the energy production. So somebody who's very low, needs building up in their energy, they may have low blood pressure. Somebody was saying, do you have a marker for low blood pressure? Was it? No. So, you were asking, is there a marker place to touch for low blood pressure? I don't get people with low blood pressure. But if you show me a patient who has got low blood pressure, I'll try and find you a marker. Okay, I'm sure there obviously is one. But sometimes people need to increase their blood. These are the people who really need the B1. They need vasoconstriction, they need to elevate their blood pressure, they need to get more energy in. Okay? Whereas G are the ones who need to relax, they need to lower their blood pressure and generally to get more vasodilation for the coronary vessels. So that's what those are all about. So smart blue complex, this is for the people in the blue regime, which would be below 5'5" or 5'6". It's a multiple vitamin. Clinical research shows that blue people require higher optimal levels of the alcohol-soluble B vitamins. Okay? And this is your B1, your B5, and your B12, along with adequate supplies of adenine, previously known as B4, to maintain cardiovascular neuronal firing. So this is interesting, B1, B5, and B12. So they all work in that mitochondrial membrane to get pyruvate across into making acetyl CoA. B1 is what we've just said there. Conditional deficiency will lead to the production of excess production of D-lactic acid. B5 is necessary to make the acetyl CoA. B12 is to get the oxygen up and to recycle homocysteine. B4 prevents nerve paralysis or loss of conduction power. Deficiency leads to split sounds culminating in fibrillation. That was Sam's patient. It prevents heart dilatation or enlargement, which distorts the heart valves, causing regurgitation. Nutritional yeast is the most abundant source of this important nucleotide. Okay, so remember that. Boron shows for blue people. It's a trace element which helps in the balance of the estrogens. Magnesium we've talked about. Sulfur is an important component in phase 2 liver detoxification, which detoxifies many hormones, transmitters and drugs. Now this is quite interesting because my experience is that blue people require predominantly sulfates. So when something comes up with a mineral like a magnesium or a zinc or an iron or any other trace mineral, they need the sulfates. Muscle test them with the sulfates and you'll usually find they strengthen to those, but they don't strengthen to the chlorides or phosphates. Okay? Because for blue people, sulfur is the key to their detoxification. And you know that blue people have a greater tendency towards building up chemicals. They're very chemically sensitive, and these chemicals can cause mutations. So it's really, really important for blue people to be able to detoxify, and sulfur is the key there. They need to eat the cruciferous vegetables. Unfortunately, they have to have broccoli and asparagus and things every day, really. Garlic, onions. You're wishing you were blue now, are you? Oh, okay. So selenium, very, very important. Again, glutathione peroxidase for these people to recycle or detoxify. And zinc for all the purposes that zinc is used for. So the smart blue complex is for blue people, obviously. Okay. So that's why we call it blue, and it's coloured blue, and it will continue to be coloured blue with the new products as they come out. So it's all in a base of nutritional yeast. So that's our nutrients in a base of nutrition. Nutritional yeast is dead. Okay? In other words, if you put that yeast into a glass with some warm water and some sugar, it will not grow. So as a result, when you take it, it doesn't grow in here, so you don't get bloated. All right? Because many yeasts will bloat you up, particularly when you then have it with other food. It is dead, and it's used as a source of protein for vegans. So it's vegan, and it won't ferment inside you. Right, greens. So greens are all that's left. So if you're not red and you're not blue, you must be green, which is the taller people. So the green complex relaxes muscle tissue, especially the coronary arteries, by its adrenaline action. Adrenaline tones up small arteries but relaxes the coronary. This is why I said that stress, which will increase your adrenaline, is actually a good thing for a green. Okay? So we need a bit of stress. We thrive on it. Greens love their adrenals. Okay, we work hard on our adrenals. We love our adrenals, and we go, 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 go until we drop. And when we drop, we wonder, well, why have we dropped? Because we're not used to dropping. We're in such good form. But when we do burn ourselves out, then it takes time to get it back up. It was you, wasn't it, I was talking to? So you're a green, and you live on your adrenals. And I think most of us do. You're a green, aren't you, Mark, I should think? Yeah. Never know. Mark and I have known each other for 30-something years, I should think, isn't it? And he works harder than me. Mind you, most people do, I think. So it contains lipotrophic factors. That means it breaks up fats to metabolize cholesterol and triglycerides. Deficiency causes a tight feeling in the chest on exertion. That's because we tend to fur up, and you tend it towards getting arteriosclerosis. So smart green complex is a multiple for green people who require higher optimal levels of alcohol. No, of the alcohol insoluble vitamin Bs. Shucks. Okay, so they have vitamin. Yeah, they're still awake. It's good at 5 o'clock now. Okay, so vitamin B2, 3, and B6. So we need B2, B3, and B6. And this is really, I found fascinating, because it's B2 as riboflavin and not as riboflavin 5-phosphate. Now, I don't know why that is, but it only muscle tests with using riboflavin. It does not test, and this is why back earlier in last year, we couldn't understand why a green person didn't respond to B2, because everybody said, oh, you should B2, because we were testing them with riboflavin 5-phosphate. But riboflavin, which is relatively insoluble, works really well. But riboflavin 5-phosphate doesn't work. So it has to be raw riboflavin. Okay? And nicotinic acid, it has to be nicotinic acid and not niacinamide. Now, the downside of nicotinic acid is you get the flush if you have too much. So this is why you must muscle test for the exact amount the person needs. Too much of it will cause you vasodilation. And if you've ever had vasodilation, and Jill was a good experiment here to try what happens if you take too much nicotinic acid. You have roughly 20 minutes to stand back before they explode. Okay? And they get redder and redder and redder, and you can see the redness, and you look in the mirror and you think, heavens, what's happened? They go, yes, it brings out the anger. And it's quite fun, because you know, it's purely, yes, it's certain areas of the skin, not all over, but it's certain areas are there. And some people actually do this as a therapy, because they say it opens up all the blood vessels in the brain. So they want nicotinic acid. They don't want niacinamide, because you don't get the flush with it. And they want to go through this flush because they say afterwards you feel fantastic, because you cleaned all your tubes out up in your brain. And that may be the case, but it's a painful way to go through it. But the good thing is it goes off after, what, half an hour?
A long time.
Yeah, half an hour. And, or you tell them it's half an hour and everything will be fine, don't worry. It's all in this case, it's a good sign. Clive went through that as well, didn't you, Clive? Yes. He had his first and probably his only hot flush. Right. So, but it is a powerful vasodilator. So we put in the amounts that the people need. We don't put massive doses in to the capsules. So vitamin B6, in this case, it has to be pyridoxal 5-phosphate. So it would appear that greens have the polymorphism as well. So we're unable to make enough P5P from our pyridoxine. Ordinary B6 pyridoxine doesn't seem to show. Again, it supports most of the hormones, etc. Folic acid coupled with zinc. We need folic acid. We don't need the B12, because usually we eat a lot of meat. Adrenal people eat, and they eat a lot of meat, and they get a lot of the B12. Okay, so we don't need so much of the B12, but we do need the repair of the tissue and the genetic recycling of it, which we need folic acid. So folic acid, coupled with zinc, of course, is essential to us. Choline, inositol, and biotin, these are the lipotrophic factors, help us break down cholesterol and fats. Boron helps postmenopausal balance the estrogens, which has an effect on bone density. Copper is essential to us. Copper goes on to make noradrenaline, which of course greens, which live on, and also involved with collagen and elastin formation. It's also an important part of the SOD, superoxide dismutase enzyme, and monoamine oxidase and tyrosinase. Selenium, everybody needs selenium really, convert T4 to T3 and glutathione. Silica, very important for our ground matrix in our joints. And zinc, because it works in over 300 enzymes in the body. So that's the smart green. So this is in a base of, we need a base of a lipotrophic factor, and the best lipotrophic factor is lecithin, okay, or phosphatidylcholine. The trouble with phosphatidylcholine is it's too much phosphatidylcholine and not the other phospholipids, whereas lecithin contains phosphatidylinositol, phosphatidylthreonine, and phosphatidylserine, whereas phosphatidylcholine is mostly phosphatidylcholine. Now I have sourced a sunflower source of lecithin, okay, which is great news, and it's organic. The bad news is we can't get it at the moment because it's only available in America and they won't export it outside of America. Bob tried to get it, didn't you, Bob? And they won't export for some reason, so you've got to wait till we go over to teach in Los Angeles in May, and then we'll bring a few gallons back. So we will have phosphatidylcholine from sunflower, because apparently when I've investigated, all phosphatidylcholine now is GM from soy, okay? And the capsules that they put it in are pig gelatin, which may produce ethical problems for certain people who don't want to eat pig, okay? Because cow gelatin and veggie caps or vegetable oil, it just melts them, okay? So it's a rather potent substance. So you need to have something which is, I think, probably is a liquid, you know, it's a stiff liquid, but we're going to see if we get it into 30 ml or 100 ml bottles. But that will be in the pipeline, and the phosphatidylcholine is really important, or lecithin, for bringing down low density lipoproteins. So when low density lipoproteins with people with high cholesterol are high, you need to introduce more of the phosphatidylcholine. So that's the three major smart products. So these were, they haven't superseded the liquids because some people still need the liquids. They can't swallow capsules. But generally, as we've modified slightly the formula, very slightly, and we've put in here, instead of the G complex, which we called it last year, we're calling it green now, and we've added the minerals. So with the red one, it's almost identical to the homocysteine formula. Everything the same, but we've added the beetroot. And with the blue one, we've added the nutritional yeast. So they're almost identical to the B1 complex as it was, but we just made slight alterations with the B1 to the B2. Could you hold? So the other smart products we'll just talk about now, just briefly: smart magnesium, zinc, etc. So essential fatty acids. These act as calcium ionizing agents for the use of muscle tissues. So remember, to get the calcium into the tissue, you need the essential fatty acids. And the best source of essential fatty acids is good natural oils. And so we made a smart oil, which is hemp seed, pumpkin seed, flax seed, black cumin, evening primrose, chia, blackcurrant, and pomegranate. And this is a nice blend in a perfect 2.5 to 1 ratio of omega-6 to omega-3. So this is considered by Perskin to be the best and optimal ratio of plant oils for the human being. Vitamin C complex, we've talked about that as the Smart C. We've talked about that one. Wheat germ oil as a source of vitamin E. We've talked about this, that we don't want sudden death syndrome from our heart muscle necrosing. On there, Jill talked about this last time, tocotrienols, which are now gaining in interest, not just tocopherols, but it's tocotrienols that have the nitroglycerine effect as the vasodilating in coronary arteries with people with angina pectoris. So it's not alpha tocopherol. If you've got angina pectoris, you can fill up with alpha tocopherol, and you've got to get up to 800 or 1,000 international units. But if you use wheat germ oil, you get the reaction much quicker because you've got the tocotrienols in. So vitamin E complex. Smart CoQ10. CoQ10 is very important when we've got heart failure. We talked about that in the first module, where that heart really can't contract anymore. It's really, we've got so much hypertrophy of the muscles. And it's wonderful because it's CoQ10 in oil. And CoQ10 is a fat-soluble substance. It will not dissolve in water. So it needs to be in an oil, and it's best taken last thing at night. And we find The reason for that is it always muscle tests on triple warmer, which is 9 till 11 in the evening. And we find it works really well if you take equal portions of the 2 active coenzymes of B12, adenosine and methylcobalamin, for optimal oxidation. These will be taken in water at breakfast. So if you've got a person who really needs CoQ10, give them the oil-based CoQ10 with adenosylcobalamin and methylcobalamin in equal portions in the morning, and that really zaps them up. CoQ10 declines with age, so we can see here over at 80 years of age, the place where CoQ10 declines first in the human body is the heart. So it's down to 42% by age 80. By 40 years, you're 68%. So if you're 40 years of age now, you're a third down on your CoQ10. So that efficiency of your heart is already not as good as what it should be. But that doesn't necessarily mean you need to take CoQ10. But if you can't make CoQ10 in sufficient amounts, you may need to take it. And if you do take it, always take it with the B12. And of course, if you're on statins, you need to take it because it blocks the ability to make CoQ10. So that's the smart CoQ10. Smart potassium, as I said, is really involved with using alfalfa. We want to slow a person down, we use potassium. So paroxysmal tachycardia, autonomic control of the heart is lost. So these are when you might consider potassium. So we looked at earlier calcium-magnesium ratio, very important, and we got potassium and sodium. Okay, so potassium is inside the cell, sodium out, calcium out, magnesium in. So getting those 4 electrolytes, the ratios right, is really important. Smart magnesium, as we said, is really important with the buckwheat. There's the smart magnesium, so it's made with the buckwheat. Smart zinc is cofactored, is important in wound healings. Anything that won't heal. And the reason is that the enzyme DNA and RNA polymerase is zinc dependent, and that's the main use of zinc. There's lots of uses, but one of the main reasons is why people don't heal. And if you've got cuts, bruises, strains, bad backs, anything that doesn't seem to heal in the way it is, think zinc. But think different types of zinc sometimes, that it may not be always the favourite one that you like, and if a person doesn't strengthen to the ones that you test them with, doesn't necessarily mean they're not zinc deficient. Okay? It's just consider it, because I think more people are deficient in zinc. When we do a zinc taste solution round, at this time of the year we'll find at least 2/3 of the people in this room won't taste zinc. If you think I'm talking rubbish, just use the zinc taste solution, and I will guarantee 2/3 of the people in this room won't taste zinc. That means you're zinc deficient. Okay? Even if you don't muscle test to needing zinc. The reason you don't muscle test to it is you're using the wrong type of zinc. Okay? So what you will find is if you test the different combinations, you will find the zinc deficiency there somewhere in about 2/3 of the room. Because it's impossible to get enough zinc. You just look at where food zinc's in. It's from everything from the sea, and most people don't eat much from the sea, and the land is now deficient so much in zinc. You'd be lucky, and if you bought a lettuce down in Kent, and you bought a lettuce in Sussex, and you bought a lettuce in Buckinghamshire, it would all have different ratios. So if the books say, lettuce is a good source of zinc or whatever, it doesn't mean it is anymore, because it depends where it's grown. So zinc is really important, but it's getting the right combo for your body type. So heart tissue extract, I talked a bit this morning, indicated when the patient has really poor heart muscle tone, muscle fatigue or hypertrophy, and it usually shows up as a really weakened first sound. So if you can't get a good first sound in, test them with the heart tissue extract. Hawthorn. Now this is another one. We found this really seems to help people with hearts. Again, works very similar to heart tissue extract. Meta-analysis previous studies concluded that there is evidence of potential benefit for extract in treating chronic heart failure. Several pilot studies have assessed the ability of hawthorn to help improve exercise tolerance in people with cardiac insufficiency. Taurine, this is an amino acid which we're introducing, has many fundamental biological roles such as conjugation in bile acids, antioxidant, membrane stabilizers and modulation of calcium signaling. It is essential for cardiovascular function and development and function of skeletal muscle, the retina and the central nervous system. So taurine is really important. It's been shown to help people with congestive heart failure by increasing the force and the effectiveness of heart contractions. So this may be something which you might consider, but most people are not going to be deficient in taurine unless they're really eating a strict vegan type of diet, because it's present in most animal types of protein. But if you've got really bad heart failure, there's no harm in trying some of these things like heart tissue extract, and because no amount of vitamins and minerals is going to pick you up when the heart is actually sarcopenia is developed in there and you're losing the muscle bulk. So in 2008, taurine has been shown to reduce the secretion of apolipoprotein B, which is the bad one. High concentrations of serum lipids and apolipoprotein B are major risk factors for coronary heart disease. Right. Okay. There's a part on here on cholesterol, which I want you to read in your own time. The main thing what I just want to make sure that you understand is that cholesterol itself is not a problem in most people. Okay, what is a problem is when that cholesterol becomes oxidized, and oxidized cholesterol is the problem. Now, cholesterol is in the cell membranes to give the strength to a cell membrane. If we didn't have cholesterol, we'd be like an amoeba. All our cells would just wander all over the place, and we'd lose our cell membrane. So cholesterol is there to give the strength. So it's there for a reason. Nothing is there not for a reason. But we have to get cholesterol to the cell when it's old and been damaged, and we have to take the old and damaged part away. So where does the cholesterol come from? It comes partly from our diet, generally considered to be 1/3 is from our diet, and 2/3 is made in the body, in the liver. Okay? So we've always got to keep a good amount of cholesterol going there. So if you restrict the dietary intake of cholesterol, you just make more. Okay? This is why they found that strict diets are only useful for people with really, really high cholesterol. If it's moderately high, then it doesn't usually make any difference at all. So they end up on a drug which inhibits you from making cholesterol. Okay, so what you've got to do is get it from the liver, and that to the cell is called low-density lipoproteins. And that's the one that raises up if it's not taken up by the cell. So if there are not enough receptors for the cholesterol to go in, the level goes up. And so what the pharmaceutical approach is to reduce the amount of cholesterol produced. Okay? So they say high levels of low-density lipoprotein are bad. Okay? So they even call it the bad cholesterol. Okay? The bad cholesterol is when that cholesterol is oxidized, and the enzyme comes along and cleaves that bad one out, the oxidized one out, and it attaches it to phosphatidylcholine or lecithin. And that transfer enzyme takes it back to the liver, and that old cholesterol is then conjugated with our friend taurine and glycine and made into bile. And beautiful thing about bile is it then emulsifies or secreted out of the liver into the gallbladder and secreted when we've got a fatty meal, and it's a great emulsifier. The downside is we reabsorb 90% of that bile lower down the intestine. So once it's done its job of emulsification, it recycles itself. So not only does all those old cholesterol fragments, but all the toxins that are in that bile all come back in again. So it's a recycling process. So the only way you can absorb bile in great amounts is insoluble fiber. So insoluble means we don't digest it. We don't have the enzymes for insoluble fiber. Soluble fiber means we digest it. This would be fruits and vegetables. Insoluble is cereals. So people have been interested in wheat bran. But wheat bran we now know irritates some people. So we moved to oat bran. And oat bran irritates other people. Now I'd be surprised how many people actually are very sensitive to oats. Can produce some really nasty headaches and things in them. So what are we left with now? Rice bran. Awesome. But the only good rice bran's got to be organic. Okay, and we found organic and we put that in our colon cleanse. Organic rice bran. Do not use ordinary rice bran. And do not, of course, you get rice bran from whole rice, brown rice, providing it's organic. So don't eat non-organic brown rice because it's probably laced with pesticides. Right? But rice is one of the safest things, providing it's organic. And it's one of the least allergic of any grain substance. There's lots of others. You can use peas and all sorts of things. But we find rice is very, very good if you can't tolerate wheat or oats. One of the best ones otherwise is rye, but this is really difficult to get You know, in Eastern Europe you can get rye bran, but I haven't been able to find it so well. So that gets you to absorb the bile, which stops you recycling so much. So you pass it out with your feces, okay, and that's good. So that keeps your cholesterol down. This is why they say, oh, oat bran on one side, okay, phosphatidylcholine on the other. So two ways of actually getting your low density down and your high density up is to go and eating bran of one form or another and taking phosphatidylcholine on the other hand. Okay? There's other things that you can do in addition, but those are the key ingredients. Okay? What statins have been shown to do is to decrease the low density lipoprotein because it stops you or inhibits the production of cholesterol in the liver. But it doesn't increase high density lipoprotein, which is the one that takes the oxidized cholesterol back to the liver to get rid of it. The only thing that does that is phosphatidylcholine is the main thing there, and bran to get it recycled. So say there are other things, but those are the key ingredients of what you really need to do. Now in the heart kit, there are the markers for low density lipoproteins and high density lipoproteins and very low lipoproteins. In there is ApoE4, ApoE3 and ApoE2, which we talked about in past seminars, and the relationship of that to the body types. So unfortunately the reds have got the short straw here. They've got the two molecules, if you remember, of arginine instead of cysteine. Okay, and it's also got the ApoA and the ApoB. ApoB is a large part of the low density lipoprotein molecule. You can always remember this of B for bad. Okay, A is for okay, so lipoprotein A is the good one. So if a person weakens to lipoprotein B, they've probably got high lipoprotein for them. Okay, and so they've got tendencies towards clogging up and cholesterol issues. Okay, so I think that covers inside the kit will be the valves. I think, Clive, for those of you who haven't got the valves, the pacemakers rather, the SA node, you must get an SA node and an AV, because this will help you work with patients even if you haven't got the stethoscope yet, just to see if a person does weaken. Because the therapy localized to that point doesn't mean that's the point. They've got an SA node, because you need the marker to cross-check. They could have a rib lesion or all sorts of things. But you will find, you can feel the arrhythmia, you can hear it with the stethoscope. So you've got the SA node in it, you've got the AV node, and you've got Purkinje fibers, and you've got the emerald. Okay, not real emerald, but it's the frequency of the emerald. Okay, so our next module, which will be in the summer, will be applying the phonocardiography work, which a lot of you by then will have got into this, into sports. So we'll be looking at what happens then when you have somebody lying on the table and then send them off around the track or around London and see what happens. Okay, so it's going to be really interesting. We've got a few patients who we've been watching now and treating pre-marathon, and they're going in for the marathon. So we'll be interested to see how they do and how to enhance this in human performance. Okay, that'll be in July, I think it is here.